Friends, myself Dr. Dwivedi welcomes you all on my channel, and this is particularly my first video, which is just going to be uploaded here regarding the NCISM rules and regulations. And since many friends and my seniors were asking about the rules and regulations that is published in the Gazette of India recently in the October month. So that is being applicable for 24-25 batch and further batches also. But the knowledge of this rules and regulation is very important to every Ayurveda scholars. And since there were many requests to make a video regarding explanation of the recently published rules of PG courses in Ayurveda, MDMS. So I'm just beginning with the downloading of the rules and regulation. That is, we have to go to NCISM India website, ncismindia.org. Here you can see in the URL box, and just going on that on the front page, that is the home page, you are just seeing many options here, and you have to click on information desk right here on the rules and regulation NCISM Act 2020. So here you just see many rules and regulations, but we are focusing on the PG courses. So at the last there are three PG regulations for respectively for Ayurveda, Siddha and Unani. So we are just going on Ayurveda, and it's here on the last fourth, and we just open it, the file, and here you see that you see the Gazette of India, and since every regulation is being published in the Gazette of India, so that's why you see here, while the act is being made by Parliament, so it is also enacted by a Parliament and also published by the Gazette, that is Act. But when it comes to the regulation, it is not enacted by Parliament, so it is made by NCISM by using the authority of the particular Act by which the body is made. So not coming in the deep of that legal things, we just go on the content of this regulation. So it is the Hindi version, and just skipping it to the English version because the English version is final. If there are any discrepancy or any error in the Hindi version, so just when you are skipping it, then you see the regulation and notification date is 1st October, but it is enacted when it is published in Gazette of India, that is it is published on 4th of October, so it is being applicable from that 4th October. So there are introduction of this regulation that is named at NCISM minimum standard, minimum essential standard assessment and rating for postgraduate institution, and minimum standard for postgraduate education in Ayurveda regulation 2024. So this is the name, and after that is see here you can see that it is being applicable after the date of publication in official gazette. So that is from 4th of October. And in the first chapter you see the definition, lots of definition has been provided, so not going into deep of that. And one thing is very important, that Doctor of Medicine is being the new super specialty is being added up here in the regulation. And some few things that you just to see that MARPISM means the Medical Assessment and Rating Board for Indian System of Medicine. That is a board of NCISM. So frequently you see this term MERBISM, and MESUG means the minimum essential standard for Ayurveda, for undergraduate Ayurveda colleges. And after that there are many things, and also the postgraduate entrance is also renamed here, that is PGNET, means postgraduate national entrance test. And here you see the very important thing, that extended permission and yearly permission has been described here. That the yearly permission means the permission given to fully stabilized medical institution every year, and extended permission status is also laid down here, that this permission is very special type permission, where the colleges will not need a permission of once given this permission, the college will not need any permission further to conduct their courses. But they have to apply for increment in the seat and opening a new program, new postgraduate program or specialty program. But yearly permission is not very much required. So if a extended permission is given, and after that the general consideration regarding this act is given. The most important thing here is the ratio that is being provided here, that for postgraduate degree seat sanctioned, the availability of postgraduate guides and student ratio, that is 1 by 3 for professor, 1 by 2 for associate professor, and 1 by 1 for assistant professor. And there are many things that the college will need to stabilize here, like it is also very important for scholars also, that institutions shall install online systems such as learning management system, hospital information management system, that is HIMS, means that will include all the data of patients related with the Ayushman Bharat health scheme, and other also schemes, and Aadhaar enabled biometric attendance system. That is very important, that students always ask that where it is written that the biometric is very mandatory. So it was also mentioned in the previous regulation of 2016 also, and also here in the 2024, that you see here the Aadhaar enabled biometric attendance system, or iris recognition or face recognition attendance system, means three type system, whatever it is applicable, but one thing is mandatory, and like that as directed by the commission for marking attendance of teaching staff, non-teaching staff, hospital staff, and postgraduate students. So that is very important. Yeah. Also the CCTV and other things, other data, biometric data will be shared to the commission by the college. So after that there are many things that is being mentioned here, and very important here is that annual intake capacity for postgraduate degree program shall not be more than 12 seats per year, means not more than 12 students can be admitted in a particular specialty, particular degree program, and the ratio is same, like 3 by 1 for professor, 2 by 1 for reader, and also 1 by 1 for lecturer. And in the chapter 3 I see that postgraduate degree programs, various programs under MD and MS, not very much important, but you may see the one thing that is added here is Ayurveda biology, a new subject, a new specialty added in the MD Ayurveda, and all those same things that was in the 2016 regulation, like Samhita, Kriya Sharira Dharma, Shastra Rogidan, Rakatantra, Swasthvit, Kumar Bhritya, Chikitsa, Panchkarma, Manas Roga, and Prasan Vajikram. And in the MS Ayurveda, there are 4 courses: Sitri Rog, Prasuti Tantra, Salatantra, Salakatantra, and that there are two sections, Netroga and Karnanasa and Mukharoga. So these are two division in the Salakatantra. And after that, you see the minimum essential standard for postgraduate institutions. So it is also important both for college and students. So it is mentioned here that the college tuition conducting the courses, the minimum standard will be same, will be mandatory as in the MESUG, means as in the undergraduate courses, and provided that these regulations for concerned postgraduate department or program. These things are very important for college, that the UG standards are minimum, they have to fulfill minimum standard for UG, but also the additional requirement provided in this regulation they have to fulfill also. And after that, there are the requirements uh, mentioned here for the colleges. So seminar halls, like these things, central library, where postgraduate intake capacity uh, is rationalized here, that 1/2, one seat for every two postgraduate student. So that is the seating arrangement of the library, and a 200 additional books is a minimum for each postgraduate department, and journals have to provided minimum 4 journals specific to each specialty will be made available. And departmental library also be there, 100 books, and digital library, that is in the ratio of 1/5, one computer for 5 students. So all these things are very crucial for the colleges to stabilize the postgraduate specialty. So this is the requirement, and all the things here mentioned for various departments. And you can see that every department has to be, if it is clinical, then the outpatient department, and the beds in the ratio of 4:1, that is very common for every department, that is 4 bed for one student, and this kind of thing, like average bed occupancy shall not be less than 80%. So this is very common in all the clinical specialty, but here for Comarbhit, there is some additional thing, that in addition to the OPD and bed ratio 4/1 and bed occupancy of 80%, there are breastfeeding area, demarcated area for breastfeeding adjacent to OPD shall be made available. So that is very specific here. Play area for children's, and for the students, sorry, for the patients, and an ICU as per the schedule 13 of this regulation. So I will provide you the schedule 13 also in the subsequent videos. So there it is mentioned, then ICU will be there, and Naujat Abhyang and Snan unit with necessary equipment, tube and tub and baby holder, and pediatric and neonatal procedure room, child development clinic. So these kind of things they are in the Komarbhate. And after that, there are some other things for Sri Roga, postgraduate department of Sri Roga and Prasudendra, and here that exclusive to OPD, one for Sri Roga and one for Prasudi Tantra, and exclusive operation theatre to carry out Sri Roga and Prasudi Tantra related surgery, procedure room or minor operation theatre to perform procedures like Yoni Dhavan, Yoni Pichu, and like other things. And additional inpatient beds should be in the ratio 4/1, that is common for every clinical specialty. And seating arrangement in the ward, accommodation for night duty shall be made available, That is also very common in every specialty. And also you see that bed occupancy of 80%, and most important here is that a minimum 20 deliveries per month shall be the minimal requirement. So this was not here in the previous regulations, so it is added here. And other things are same for departments. And minimum essential requirement of human resources like teaching staff and non-teaching staff, that is provided in the schedule 10 of these regulations, and also other further schedules like schedule 12 for additional hospital staff. And here the timeline to stabilize all those requirement that is given for the colleges. And minimum standard for standalone post-graduate institution means the institutes which has only PG specialty, not undergraduate course, that is called as standalone institution. So the minimum requirement is being given for the institutions, and specifications has been provided here. And moving to the next, that you can see that the minimum requirement is given in the schedule 9th and 11th for the standalone institutions, and the timeline here is given also. And inspection or visitation or assessment, that is very much different here and from the previous regulation. So I will just make a highlight here that the every institution will be inspected, visited, assessed by MARB ISM, that I have said you earlier. And after that, fully stabilized departments shall be categorized into two categories, namely extended permission and yearly permission. So extended permission is a new concept here. And here fully stabilized specialty permitted by MARB consecutively for preceding 3 years shall be considered under extended permission category. And under this category, extended permission, college is eligible to department is eligible to participate in the counseling process and admit student every year as per the sanctioned student intake capacity without obtaining permission from MARB unless otherwise denied by MARB as a result of suo motu visitation or assessment. Means that it will be not very obligatory to find approval of MARB, but if the MARB visit uh, voluntarily by a suo motu cognizance, and they do the assessment and deny the college, then they will not participate in the counseling. Otherwise, they can participate in counseling without any uh, permission, without getting any permission by MRB every year. And the postgraduate department have the so that the postgraduate institutions will be visited by MRB, and the decision of the assessment shall be given 60 days before the counseling of admission year. So the counseling is not will not be get delayed. And after that, it is also said that if the college or department uh, specialty under the extended permission did not receive any communication 60 days before the commencement of counseling process, uh, of ACCC, it will be presumed that Department of Specialty hold is status of extended permission for that year. So that shall not be allowed to that shall be allowed to participate in the counseling and admission processes. So that is very important regarding the extended permission. And moving to ahead is the very important chapter, that is chapter 7. And this is very important for postgraduate scholars, because the minimum standard of education of postgraduate degree program, Doctor of Medicine and Master of Surgery MS, has been provided here. So I would just like to tell you that this chapter is long, and I will try to complete this chapter, but if I cannot complete it, then I will provide it in the next video. So, but this is very important. So here the postgraduate degree program wise specific competencies, means the following competency should be developed in a postgraduate degree program. So it is very important for the courses of Ayurveda, Samhita and Siddhant. They will be having the competency or ability to read and understand the Samhita, ability to apply Tantra Yukti appropriately, and to understand and apply Anukta and Losya Ukta, understand commentary and apply appropriately in understanding Samhita, and ability to stabilize principle described in Samhita, and the postgraduate in Samhita and Siddhant shall be specialist in critical appraisal of Samhita and application and its application in clinical practice. So it is also very important. And in Ayurveda biology, the ability to understand and apply knowledge of Ayurveda biology, Ayurveda Ayurgenomics, ability to stabilize Ayurveda fundamental principle on the lines of advanced scientific method or parameter, ability to demonstrate the principle of Ayurveda through experiment of molecular biology, biotechnology and genetics, and demonstrate molecular mechanism in physiological and pathological processes, ability to understand and demonstrate Bij and Bij dose on the line of genetics, ability for genetic counseling, and postgraduate in Ayurveda biology shall be a specialist in Ayurveda biology. Further, informatics and Ayurgenomics. And after that, the Rachana Sharir, the detailed understanding of the structure of human body, and dissect the human body systematically, ability to understand Saptadhatu, ability to locate Marma in the human body, and demonstrate surgical anatomy, embalming and preparation of organs and sections of specimen for anatomy museum, ability for plastination of organs, and understand and demonstrate advanced anatomy aids like 3D anatomy table and other e-dissection software. The postgraduate in Rachana Sharir shall be the specialist of Rachana Sharir. After that, Kriya Sharir, ability to understand and demonstrate physiological function of human body in detail, ability to assess and demonstrate Ayurvedic physiological entities like Prakriti, Sar, Samanan, Dosh, Chai Vriddhi, and other Ayurvedic physiological concept in detail, ability to conduct and demonstrate physiological tests and experiments. The postgraduate in Kriya Sharir shall be the specialist of Kriya Sharir. After that, Dragud Vigyan, ability to understand and demonstrate Ras Panchaka, like Rajgun, Veer Vibhag, Prabhav, ability to identify and authenticate the Vanaspatic Dravya, that is medicinal plants, and ability to conduct and demonstrate pharmacognosy experiments, ability to apply Grahya and Agrahya Lakshan, including quality control issues of raw drugs. ability to clear controversy and suggest substitute drugs, ability to define with pharmacological properties for new herbs, ability to conduct and demonstrate pharmacological experiment including animal studies, and knowledge of tissue culture, bioinformatics, network pharmacology, stem cell experiments, etc., and other emerging areas related to the background. The postgraduate background shall be the specialist of identification and biological actions of the herb. After that, Rashastri and Bhasaji Kalpana, fundamental applied knowledge in Rashastra and Bhasaji Kalpana in detail, ability to understand the process described in Rashastra in the light of chemistry and chemical technology, classical and contemporary knowledge of drug manufacturing, including newer dosage form and drug development, ability to identify the need and area of research in Rashastra and Bhasaji Kalpana, familiar with the drug standardization and quality control as well as the quality assurance methods and related equipments, knowledge of standard databases pertaining to drug and ability for preparation of the dossier, familiar with the drugs and cosmetics and other relevant acts, knowledge of pharmacovigilance along with its need, scope, and objective, and ability to authenticate raw materials of the Rashastra, understanding and application of material and operational management, clinical pharmacy, and pharmacy practice. The postgraduate in Rashastra and Bhasaji shall be the specialist in Ayurvedic pharmaceutics and pharmaceuticals. So every line is very important, and these competency are very much required if you are doing PG courses and going to hold the degree of MD and MS Ayurveda. And after that, Roog Nidan and Vikriti Vigyan, the scholar shall have the ability to understand Samprapti and Panchal Lakshan Nidan, and like Nidan, Samprapti, and Rakshan, Purrup, Upadrav, and these kind of things. They should be very uh, clear and very much have competency in that area, and ability to understand the basic pathology, systemic pathology, and pathological process and interpret or apply in Ayurveda perspective, ability to carry out appropriate investigations, biochemical, microbiological, imaging techniques, histopathology, and the like for confirmation of clinical diagnosis. So it is very important that these kinds of investigations are being prescribed as the competency, like histopathology and imaging and other investigations. And postgraduate of Rognidan and Vikriti Vigyan are authorized to sign and authenticate diagnostic investigation or test to the extent of teaching and training. Means they can authorize any investigation as per their teaching and experience in clinical training. Postgraduates of Nidan are authorized to establish and manage diagnostic laboratory with diagnostic facility to the extent of teaching and training. Means they can stabilize and manage a laboratory. That is very important. It was never before, and it has been included in this regulation. So you can do all kind of thing that is being mentioned here. That is very much significant. The postgraduate in Rog Nidan shall be specialist of pathology and laboratory diagnosis. So this regulation empowers the PG scholars of Rog Nidan as a specialist of pathology. That is very much significant. Earlier it was being in a question mark that whether they are a laboratory, there are specialists of laboratory diagnosis or pathology. So it's been mentioned here, particularly in this regulation by Gazette. अगर तंत्र एवं विधि वैद्यक ability to diagnose poisonous condition and its medical management, ability to identify the doshivish garavisha in present context and suggest remedial measures, ability to deal with clinical conditions and their complications caused due to poisons and allergens, ability to deal with medical jurisprudence. The postgraduate in Agattanta shall be considered as the specialist of Vishigitsa and medical jurisprudence. So it is also very much important, like the medical legal investigations will be in the purview of this postgraduate specialty, and the poisonous conditions and their management is being included here. In Swasthvit and yoga, ability to lifestyle for lifestyle management as per Ayurveda, and Mr. Yoga for healthy and disease individuals, and ability for dietic practices and public health measures, and they'll be specialist of lifestyle management and public health. Comorbidya will have the ability to manage clinical conditions in general in children up to the age of 18 years, uh, and ability to understand normal child, implementation of immunization schedule including Shonprasan, ability to administer Panchkarma procedures in children up to the age of 18 years. He or she shall be the specialist in management of Bal Roga. So there the management of clinical condition has been prescribed for this PG specialty, very much significant. And moving ahead to the Kachikissa, the ability to diagnose clinically, interpret and correlate diagnostic investigation reports and arrive to the diagnosis and treat the patient accordingly, ability to give appropriate treatment in acute and chronic clinical conditions, ability to manage clinical condition in general and the referrals in the particular. So it has been very much in queried that whether the MD Kachikissa can manage the acute conditions. So that is obvious here. It is mentioned in the point C, and ability to ascertain the fitness for Panchkarma, Shalya, Shala, Kestri Rog, Prasudita, the procedures, and give certificate for the same. So here the fitness is being provided by the Kachikitsa MD specialty degree holders. So it is very much important because it is being given by anesthetist by the MD anesthesia in modern medicine of system. And after that you can see here that ability to advise appropriate investigation, biochemical, microbiological, imaging techniques, biopsy, and like for the confirmation of diagnosis for the benefit of patients. And the postgraduate in this specialty shall be specialist of Kachikissa. Panchakarma evam upakarma. So here the ability to identify disease condition appropriately for any of the Panchakarma upakarma, and ability to select, plan and administer Panchakarma procedures suitable to the clinical conditions, ability to certify the fitness of Panchakarma, ability to administer Panchakarma procedures, ability to manage complication of Panchakarma procedures. The postgraduate in the Panchakarma shall be specialist of Panchakarma procedural management. Stri Rog and Prasudi ability to manage gynecological condition, ability to perform gynecological and obstetric surgery as per the teaching and training. That is very much important here. So every time I have the query, I get the query like of the students, like they can do the surgeries or not. that was not mentioned here in the previous regulations, but this time it has been mentioned here specifically that they will have the ability to perform the gynecological and obstetric surgery as per the teaching and training, and other therapeutic procedures like Uttar Basti related to the specialty. Ability for antenatal care and conduction of deliveries, and ability to conduct diagnostic tests related to the specialty, ability to undertake the conception and contraception measures as per the teaching and training received. The postgraduate in Stri Rog Prasuti Tantra shall be specialist of Stri Roga Prasuti Tantra. Shailatantra, here we can see the lots of procedure has been described according to the previous amendment in the regulations in the 2020. In addition to that, many other things has been added here. So here it is very important that they have the ability to the MD or MS or Shailatantra have the ability to perform surgeries as per the teaching and training received, ability to diagnose surgical condition and suggesting and carrying out necessary diagnostic tests specific to their specialty and interpret the result of diagnostic tests. Ability to perform surgeries as listed below, Lekhan and Chedan of Dusht Nijvarna, means debridement or fasciectomy or curetes, Bhedan of Vidradhi, incision and drainage of the abscess, Goda Vidradhi, Stan Vidradhi, means the perineal abscess, breast abscess, axillary abscess, and cellulitis. Sandhan Karma, all types of skin grafting, SSG, EGM, cross flaps, Karnapali Sandhan, the lobe repair has been authorized here, and Chedan Karma of Granthi elbow means the excision of simple cyst, sebaceous cyst, dermoid cyst, all kinds of cyst and benign, or even the benign tumors also like lipoma, fibroma, schwannomata of non-vital organs, and Chedan Karma of Sirasana Imkoth means the excision or amputation of gangrene, Sadhyogram management like the traumatic wound management, and Sivan Karma all kind of suturings, hemostatic ligatures, and Sandhan Karma of Sira Kantrasana like the ligation and repair of tendon and muscles. Pranashta Salinaharan means the removal of metallic, non-metallic foreign bodies from the non-vital organs, and Bhagna Chikitsa like close reduction, immobilization, implants or cost, they can do it all. So there is a clear cut competency here been shown. And also the correction of Sandhi Moksha, Udar Rog Chikitsa, the Udar Vishraman means the laparotomy or paracentesis, they can do it. And Arsa Char Karma, Chedan, rubber band ligation, sclerotherapy, IRC, radiofrequency, laser ablation, all the kind of things for hemorrhoids, hemorrhoidectomy, and Parikartika, Saniruddha Gurda means the fissure in ano, sphincterectomy, anoplasty, this kind of thing. Bagandar, Chedan, Chart Sutra, fasciectomy, and fasciolotomy also. Nadivaran Chedan, Chart Sutra, Godabhransha Sandhan Karma, Asmadi Nirharan means the suprapubic cystectomy or cystolithotomy, Mutra Graha or Mutra Kricha, like Mutra Kricha, Mutra Marg Vivardhana, like urethral dilatation and meatotomy is also being prescribed here. So very large range of procedures. Nirdu Prakash, phimosis, Parivartika, paraphimosis, circumcision. So these kinds of things that is even being performed by a urologist. So this kind of things has been here. Vridhi रोग चिकित्सा संधान कर्म means the management of hernia like herniatomy, herniography and hernioplasty. Mutra Vridhi Vedhan hydrocele eversion of the sac. Ligation of hemangioma, vascular ligation, ligation of varicocele, varicose veins and or stripping surgery, स्तन ग्रंथि और अर्बुच्छेदन, excision of benign cyst, benign lesion, tumors of breast, lump biopsy, आशुकारी उदर शूल शस्त्र कर्म उदर पाटन, foreign body removal from the stomach, use of advanced nadi यंत्र for श्रोतोदर्शनार्थ, क्रिया सौकर्य like video proctoscopy, sigmoidoscopy. It has also been allowed here and mentioned in the competency. Ileostomy, colostomy, resection, anastomosis in emergency, sigmoidoscopic biopsies, polypectomy, Undupuch Shodh Sastrakarma, that is the Ayurvedic term for appendicectomy. Vedhan Vishravan of Abhyanta Vidrithi, appendicular abscess, Pitta Ashmani Niharan Shedan, that is cholecystectomy, laryngeal mask airway intubation, bag or mask ventilation, suprapubic cystectomy, suprapubic cystolithotomy, excision of calcified plaque, Peyronie's disease, orchidopexy, orchidectomy, varicocele high ligation, spermatocele, gynocele, pyocele, hematocele drainage. Ability to manage surgical complications, like the ability to perform the anusastra karma and to manage their complications, ability to perform the parasurgical procedures and to manage their complications, ability to perform the diagnostic surgeries. The postgraduate in the Shalyatantra shall be considered as the specialist of Shalyatantra and Shalajikitsa. Means the lots of definition and the lots of scope of procedures has been provided here in addition to the previous regulation. So you can see that how much significant it is for you if you are going to pursue the degree in MS Shalya and other specialty as well. And moving ahead to the Shalakya Netra, there are also the many kind of surgeries has been provided here, like the ability to diagnose and manage the clinical condition related to the eye, ability to operate advanced diagnostic tool related to the ophthalmology, and to perform the routine and advanced diagnostic procedures related to the ophthalmology and interpret the result. So you have the many much scope for all the procedures here, which is performed in routine. Ability to perform various therapeutic procedures related to eye and perform the surgeries related to the specialty to the extent of their teaching and training. Ability to perform the surgeries as listed below. So list of the surgeries here. You can see the Vardhamagat Roga, disease of eyelids. That is many kind of surgeries like Vathat Vardhama Shastrakarm, surgery for ptosis, and Vardhama Vikriti Shastrakarm like ectropion and entropion, and Lagan Bhedan, Lekhan Shastrakarm like chalazion, incision and drainage. Vardhamarbud Chedanakam, like the excision surgery of benign tumor. Shuklagat Roga, like Arma, there are Chedan Shastrakam, like the excision of pterygium. Krishnagat Roga, in Krishnagat Roga, Ajkajat, where Chedan Karm is mentioned here, like that is iris prolapse excision surgery. And Sarvgat Roga, here the Adhimanta, Bhedan Shastrakarm, glaucoma, where trabeculectomy is prescribed here. foramen Salakya. And the disease of Naina Bighat, trauma to the eye, like Bhuvaratma Shukla Mandal and Krishna Mandal Abhighat, Sandhan Shastrakarm. So there is the scope of trauma repair surgery in the cases of injury to eyebrow, lid, conjunctiva, sclera, and cornea. So very important it is. And Triyak Netra, Prakrit Netra Sthapan Shastrakarm means there is a procedure for squint surgery like esotropia, exotropia, horizontal horizontal muscle resection and recession. Puyalas like Bhedan or Chedan Shastakam for dacrocystitis means the dacrocystomy dacia and is applied for dacrocystitis means BCT. And for Lingnas, Kapha Shastakam means the cataract surgery is being prescribed like the cataract extraction with IOL implantation surgery. And in that, the intracapsular cataract extraction ICCE, extracapsular cataract extraction ECCE, and small segment cataract surgery SICS. Hypoemulsification and are prescribed here for the cataract surgery. And also the types of IOL has been prescribed: PCIOL, ACIOL, and IS fixated IOL. And Sthanic Sangyaharan, local anesthesia in the eye, like peribulbar, retrobulbar, parabulbar, and intracameral. The postgraduate in Shalakya Netra shall be specialist of Netra Roga Chikitsa. And in the process of Shalakya, in the competency of Shalakya Karna, Nasa, Evam Mukh Roga, the ability to diagnose and manage the clinical condition related to the Karna, Nasa, and Mukha. KMK is the short form here that has been prescribed in these situations. Ability to operate advanced diagnostic tool related to Karna, Nasa, and Mukha. Ability to perform routine and advanced diagnostic procedures related to Karna, Nasa, and Mukha and interpret the result. Ability to perform various therapeutic procedures related to Karna, Nasa, and Mukha to the extent of teaching and training. And there are the many kind of surgery has been prescribed here related to the extent of the teaching and training. And these are Karnapali Sandhan Shastrakarm, lobuloplasty, and Karnasrav or Ashu Kari Madhya Karnashodha Bhedan Shastrakarm has been prescribed here, like acute superior to otitis media and or gluteal or secretory or serous otitis media, laryngotomy. Knowledge of Jeerna Madhya Karna Sodh Shastrakarm, like chronic suppurative otitis media, CSOM, that is very common in the children's also. So the safe tympanoplasty and safe mastoidotomy is being prescribed here. Nasa Gatroga, and the Nasa Gatroga means the nose, related to the nose. It is Nasa. In the Nasa Nah, there is Shastrakarma, like the nasal septum surgery or septoplasty, SMR, or Nasar's Chedan Shastrakarma, nasal polyectomy. FESS surgery, functional endoscopic sinus surgery, Nasa Vikriti, and Nasa Sandhan, deformed nose, the rhinoplasty is also prescribed here. So you see the how much variety and how much large range of surgeries been made available for this branch also. and Mukh Roga, the Kal Roga, throat diseases, and that the Ashukari, Gilayu Vidradi, and peritonsillar abscess, it's drainage, incision and drainage, and Gene Gilayu Shod means the chronic tonsillitis, where the tonsillectomy is prescribed. And Osthagat, Ostbhed, Sandhan Karm, yearly prepare. And the postgraduate in this Shalakya KNM shall be specialist of Karnasa and Mukchikitsa. And Manas Rog and Mano Vigyan, the ability to diagnose and Manas Roga, ability to conduct counseling, de-addiction cases and center, and conduct a specialized investigation with the specialty, and the will specialist of Manas Rog Chikitsa. Coming to the Rasayan Vajikaran, ability to diagnose manage infertility, and ability to diagnose and manage sexual dysfunctions, ability to undertake measures for Susantan, and select and administer Rasayan or Jaskar in respect to the health promotion and rejuvenation, and ability to conduct diagnostic procedure like Doppler for varicocele, penile Doppler study, Reto Pariksha, computer aided semen analysis, CASA, cervical mucus examination, postcoital test, sperm function tests, etc. related to the specialty and interpret results. Ability to administer therapeutic procedures like Uttar Basti, both male and females, intrauterine insemination, etc. related to their specialty. The postgraduate in Rasayan Vajikaran shall be the specialist of rejuvenation and reproductive medicine. And finally, the medium of instruction. The medium of instruction shall be Sanskrit or Hindi or English or any recognized regional languages included under 8th schedule of the Constitution. In the case of postgraduate department, is admitting students from different states. In such cases, the common language such as Sanskrit, Hindi or English shall be adopted. Mode of admission to postgraduate degree program. The eligibility criteria for admission to postgraduate program is there are the lots of things here provided for the admission related procedures, in which you can see the eligibility criteria for entrance for admission in postgraduate program that shall be following, namely graduate of Ayurveda Bachelor of Ayurvedic Medicine and Surgery from recognized institution. Yes, you have completed the BMS, and registered medical practitioner registered in a state or union territory or central register, qualified in postgraduate national entrance test, means the national entrance test, which is you can see the renaming has been done here instead of VIPGT. So these three criteria are very very important to make an admission, and the qualification is same, like 40 percentile shall be in PGNet exam, and for scheduled caste and scheduled tribe, other backward caste, the marks will be at 40th percentile, and All India quota will be for deemed university shall be 100%, and university and institutes where already more than 50% All India quota shall continue to maintain that quota, and 5% of the sanctioned intake capacity in government and government-aided college shall be filled up by the candidates with disability in according with the provision of Right of Person with Disability Act 2016. So there are lots of things here that has been mentioned, and after that there are the investment intake capacity and student guide ratio that I have said earlier, that is same 3/1, 2/1 and 1/1 for professor, associate professor and assistant professor respectively. and after that the duration of course and redness. So that is after that there is a large kind of thing and that needs very special attention, so I cannot complete it here right now. So I have to just make a separate video for that in reference to that, where I will complete the rest portion of this regulation. That is very very important. So just I will ask you all to drop any query if you have in the comment section, and also share with your peers and seniors and also the juniors uh, and your professors or teaching uh, staff and colleagues, all of them who are just engaged in this Ayurveda education, so that this information will be made available to all. And if you have any query, then you can ask surely in that comment section. So thank you all, and if you can subscribe this channel, then you will get the notification. Otherwise you have to search it all and you will get this video on my channel. Thanks very much.